Hello, I am Jyotika. Welcome to Excelling Psychology. In today's lesson, I will be discussing paper 3 answers for May June 2024 paper, variant 1. I don't think I'll be able to cover all the answers in this lesson because I will be discussing with you how to write the answers. That is, I'll be giving you tips on how to look at the command terms, the marks, and answer accordingly. And also I'll discuss some of the frequently made errors by students in answering. So that takes some time. So I'll make this lesson in parts. Let's see today in part 1 how much we can cover. Okay, so let's come to the first question. A professor wants to improve doctors' verbal communication with patients. Suggest one way to improve the doctor's verbal communication with patients. As we know, this question is coming from patient-practitioner relationship. Under verbal communication, we are having two studies. One is by McKinley and the other is by Savage and Armstrong, which is the key study. Now, when it comes to a 2-marker answer and one way has been asked for, definitely we'll be able to take one way from either one of the studies. So it's up to you which one you want to take. If you take the McKinley study, you will have to suggest something on the lines of being more clear and more instructive with patients. And if you take Savage and Armstrong, then you will have to explain something about using a directive style as against a sharing style. So whichever study you know better, you can quote a result from them. Also, one question students frequently ask is, do we have to only quote from a study or can we write from the general theory on verbal communication? Any suggestion? Yes, you can give a suggestion from any theory as such. You don't have to give from a study. But if you see the next part of the question, explain why your suggestion would be better for these patients. You would have some difficulty being able to explain this without reference to any study. Studies, as you know, they give you empirical evidence that some strategy is correct. So definitely if you've taken a finding from a study, you can justify it by saying that that is what was found in the particular study. Now, if you give a general theoretical suggestion, how would you explain why your suggestion is better? So think holistically. I would also recommend, that's why whichever questions are in parts like A, B, ABC or A1, 2, whatever it is, read it fully, read those questions fully, that is read both parts or how many ever parts are there before answering. Never rush into writing answers because then this is what happens, because you haven't read the second part and you've answered part 1 mindlessly, you find it difficult to write something for part B. Okay, as of now I'm taking a finding from Savage and Armstrong study because it's the key study. Most students are more comfortable with that. How we should answer the question is, of course, writing the correct question number. Whenever they suggest one way, ask for one way, one suggestion, we should name the suggestion first. That would be one sentence, and next sentence we can explain the suggestion. So that will account for 2 marks, 2 sentences for 2 marks. Many students have a habit of writing really lengthy answers, so they'll go into the fine details of Savage and Armstrong study, even those details which are irrelevant, such as how many participants were there or how the doctor decided to use a directive or a sharing style. Make sure for 2 marks you're just writing 2 points, because if you're going to write really long answers, there are 2 issues with that. One, most of your answers is going to get not even be credited, like the examiner is not even going to read it, because the examiner does not have to go through long lengthy answers for 2 marks. They have a certain mark off that they will read only these many points for 2 marks. So giving unnecessary details is not going to give you any extra credit. And at worst, if somehow, I will point out when those type of answers come, if somehow the first 2 points only are being read by the examiner, the rest is being ignored, if it is that type of question. So if your answer is somewhere in the latter half, which is going to be ignored, you're not going to get any credit at all for that. Secondly, If you're going to spend so much time on writing one answer, you will not have time to attempt other answers in the paper. So you are going to lose the forest for the trees basically. So don't take that type of approach. Okay, so here they've asked for one way suggestion. I would say one way is to use a directive style of consultation Now I've named the suggestion, I have stated what it should be, that the doctor should use a directive style. Of course, I need to elaborate and explain what is the meaning of directive style in the next sentence. It's as simple as that. So I can say that is, the doctor should be instructive and directly Okay, I'll look at the question, what they've said. Improve verbal communication. So directly communicate to the patient about what needs to be done. There's no specific scenario given to us as such. They're just asking for general improvement in verbal communication. So I'm not able to relate it with any example that what the doctor should be direct to the patient about. So I've just written it vaguely, whatever has to be done. The key thing is, while marking, they're going to look out for whether your suggestion is correct. They'll give you a mark, and then whether you've explained that suggestion. How I have explained is in terms of being instructive and directly communicative. So I'll get 1 mark for that. And again, I will strongly emphasize, do not write more than this. Typically, you will not need more than 2 sentences for a 2 marker. Don't waste your time writing more. Now let's look at part B once again. Explain why your suggestion would be better. Now here I can quote the study by Savage and Armstrong, and with reference to that explain why the suggestion is better. So again, here also I have to be very precise to the point because it's for 2 marks. How I can structure my answer is, in the first sentence I would explain that these are the findings of Savage and Armstrong study. That will give me 1 mark. And then in the second I'll explain exactly what they have found in the study. How they found that directive style is better than a sharing style. So I would take it as B. This suggestion would be better. You can see I keep referring to the question for the wording so that I don't make mistakes by adding some words of my own. What happens is sometimes we interpret the question in the wrong way, so then the type of language we use is inappropriate. So best thing is to just follow the lead of the question. So this suggestion would be better for the patients because Savage and Armstrong have provided empirical evidence that it is preferred by patients. In their study, they established that doctors are perceived as being more knowledgeable while using a directive style, enabling patients to receive their communication better. In my mind, I have thought about the sharing style and how in that study patients felt that if they are questioned too much by a doctor taking a sharing style, that makes them feel as if the doctor is less knowledgeable. So I have thought of it in my mind, and I've been able to contrast it with a consultative style. With a directive style. Now, why I haven't used sharing style in my answer explicitly is because the scope of the answer is not so much that I should be able to cover what is a sharing style as well and then contrast directive and sharing style. That is something I would be able to do if it was a 4-marker answer. So no doubt we have to know all the findings properly in our mind, and we have to bring about what the result was given the findings of the study, but we have to make it very exact to the question. Right now the recommendation I have given is that a directive style should be used. So my focus should totally be on that, because for 2 marks I'll be able to only justify properly why directive style is preferred by patients. What's the reasoning behind it? I shouldn't go further, because even then again that is not credited. So if I point out what is wrong with the sharing style, that is not going to be credited. So why should I waste my time writing that much? Then I lose time which I have for other answers. So again here how the marking will be done is that for naming that the reason is there is empirical evidence, I'll get 1, and then exactly what that empirical evidence is, how it has shown why patients prefer this type of communication, for that I will get 1 more mark. Okay, let's come to the next question. Now these type of questions are very typically found in the paper. Some issue or debate they will ask us to explain in general first. So the key thing here is whichever issue or debate they have given, for 2 marks they are asking for what it is. If they wanted us to relate it with a study or theory, they would have specified here itself. So clearly it means in the first part A, they do not want us to relate it with any theory or study. So always for this part where they do not name the study, for that part we just have to say in general, without reference to any theory or study, what this debate is. Okay, I think we've seen this answer repeatedly. I must have covered in some of my videos also. So let's quickly get down to it. When it comes to nature versus nurture, if they're asking, it's very clear-cut structure that we have to follow. 1 mark for answering what nature is and 1 mark for answering what nurture is. So nature is an explanation of behavior. That attributes it to genes inherited by an individual. Nurture is an explanation that attributes behavior to learning from the environment. This question comes up a lot in AS and A in general, asking what is nature and what is nurture. The most common mistake I have found is students are not very clear in their mind what it is in general, although it seems very simple, but students will say nature is this behavior, it is behavior because of genes, nurture is behavior because of environment. So first thing is, nature, nurture are not behaviors, they are explanations. Okay, so be very clear what you're talking about. If I say, for example, that patients perceive communication as better when it is directive, their perception is the behavior and the directiveness of the doctor is the explanation. I know it sounds very basic, but then basics is what students are making mistakes in. So if you don't know the difference between what is an explanation and what is a behavior, you will not be able to define the concepts correctly. So first be clear on that. Secondly, many students do not understand nurture correctly. That's what I've understood. They are not able to differentiate between what is situation in individual versus situation debate and what is nurture in nature versus nurture debate. For them, a situational explanation is interchangeable with a nurture explanation. That is why they'll say nurture attributes behavior to the environment. The key thing is nurture attributes behavior to learning or development, which takes place over time. When I say something is situational, let's take a simple example. If I'm saying some health condition, let's say heart disease, is because of the situation, then I'm trying to point out there's some immediate situational factor which is causing heart disease or compounding it. But when I'm saying it's because of nurture, I'm trying to say over time some environmental factors have kept on influencing the heart of the person such that it has developed disease. That is the difference between situational explanation and nurture explanation. Situational is more immediate, nurture is something that develops over time. Your answer has to reflect this understanding. So understanding is at the heart of your answers. When you try to memorize, then you make those type of mistakes. Nature is behavior and nurture is behavior. You should have clarity essentially what all the issues and debates mean. Next question is explain one strength of gate control theory of pain from the nurture side of the debate. So in your mind, you don't have to write all of this, but you should think of when we say gate control theory, how do we relate it in the first place with nurture side of the debate? Now, gate control theory suggests that when it comes to the smaller fibers which detect pain as compared to larger fibers which detect other types of touch, there's a gate which controls the information that reaches to the brain. So the smaller fibers are able to deliver pain messages to the brain, but if the larger fibers are stimulated, then they can prevent that pain related information from getting to the brain. So essentially they can close that gate which takes the information from the smaller fibers to the brain. So now how does nurture relate to this? Because that stimulation of the larger fibers which are there could be because of over time learning type of factors which are there. For example, over time through the practice of meditation or through listening of music or any relaxation technique, a person can master stimulation of the larger fibers such that the smaller fibers which are delivering pain have the gate shut and they are not able to deliver the pain to the brain. So that is how we can explain this. For 2 marks, how we can structure the answer is, again we name the strength first. So first sentence will be naming it and second strength will be just elaborating on it or explaining it. 2 markers are generally structured that way: naming, elaborating, naming, explaining. Okay, so I would propose that one strength is, now when I say that people can use relaxation to stimulate the larger fibers, definitely I'm indicating there is some usefulness of the theory, or that it can be put to practice to reduce the experience of pain. That means the strength I'm talking about is application to everyday life. So I should explicitly name it in the first point. And then I can elaborate. Here I would like to give an example to elaborate because that will make my point clearer. So here I can say, for example, learning to relax or meditate over time can enable a person to stimulate their large fibers over time that would close the gate for smaller fibers during experience of pain, thereby lessening pain sensations. So here I would get 1 mark for naming the strength and again 1 mark for explaining it. Okay, so simple 2 markers so far, very easy to score if you have even read through carefully through the health syllabus. These questions are not very difficult if we go to see. Let's come to the next question. Becky has broken her leg and is in lot of pain. She has tried both biochemical and psychological treatments for pain. Her doctor has suggested she use an alternative treatment. Okay, the first thing to keep in mind, this is a situation based question. This is a scenario based question. I have to only relate no matter which answer I write to this scenario. If I was not to relate the answer to the scenario, there was no purpose of giving the scenario. So first thing to hold in mind is I must use wording from the question to write my answers for this section. Let's see what the question is. Outline 2 alternative treatments that Becky could use to manage her pain. Have they asked me just in general outline 2 alternative treatments? No. They have asked which Becky could use. Again, they are emphasizing application. What happens is, despite the question paper being so explicit about having to apply knowledge to the scenario, the most common mistake, and very frequently we see students do not relate the answers to the given context. So that is why I am emphasizing so much, because as obvious as it might seem to some students are absolutely ignorant on how you need to relate the answers to the scenario, and you cannot score without that. Maximum you would score 50% marks, which will really bring down your marks. Okay, now 2 alternative treatments which we have learnt in the syllabus. One is acupuncture, the other is TNS. So definitely we could use those provided we relate them to Becky's scenario. How we can structure the answer is, it's a 4 marks. Actually you can think of it as a 2 marker into 2. So what you can do is name one treatment, then explain it with context to Becky. So here you get 2 marks, 1 mark each point. Next you name a second treatment and then again you explain it with context to Becky. So there you get another 2 marks. So that's how you get a total of 4 marks. What is the key thing in Becky's scenario? Just keep in your mind before writing the answer. She's broken her leg, she's in lot of pain. These are the wordings you can use in phrasing your answer. So I would suggest that one alternative treatment for Becky is acupuncture. It would involve, okay, my wrist is in lot of pain right now, so please ignore the handwriting. I know it's not very good, and also I did not have the time to type out the answer, so please bear with me. If the handwriting is difficult to understand, please focus more on what I'm speaking out, because I'm narrating the whole answer as I'm writing it. So it would involve inserting needles at different points of, okay, I think it was leg pain. I'll just check quickly. Yeah, leg pain. So of Becky's leg, and stimulating them electrically to reduce Becky's pain sensations. Okay, now one question I'm asked frequently, can we answer in bullet points? No, you must answer in paragraph essay format, not in bullet points. That's a bad practice, not a good way of developing your writing or communication. Secondly, for presentation sake, though these things are not very important, should you break down the answers to paragraphs? You do not have to. If there's a lot of clarity in your answer, like you're saying one alternative treatment is this and the second one is this, so even if you continue from here only, It shouldn't be an issue, because the way you're presenting the answer, the wording is making it very clear where you're ending a point and where you're starting the next. Nevertheless, for neater presentation, yes, you can break down into a second paragraph. That's up to you. These things don't matter in getting marks. It's just that could make it easier for the examiner to read. So out of empathy for the examiner, definitely you can show such consideration. So we would say another alternative treatment. For her could be TNS, transcranial electric nerve stimulation. Electrical nerve stimulation. It would involve TNS. Before I write, some students, I don't know why they're a little confused about TNS, whether it is magnetic or electric. The name itself includes the word electric in it, electrical nerve stimulation. So I don't think there should be much confusion. Nevertheless, if you get confused about these things, just take a good reading from the textbook. You do not have to memorize everything, but if you just read also carefully, you will be able to understand. So it would involve placing a small device on the area of Becky's leg that is paining, and delivering a mild electric current to it to relieve pain. Okay, so what we've done is essentially we have named each possible technique. So we get 1 mark for naming, and we have explained the technique but with reference to Becky's scenario, not just in general. We don't say things like in acupuncture needles are placed and they're electrically stimulated, or in TNS there's a small device that is used to pass an electric current. We don't write general statements like this without referring to Becky. The next one is a continuation. It's the next part of this question. Explain for one of the treatments, one weakness of this way for Becky to manage pain. Again, as obvious as it might seem, they have asked you for one of the treatments. In fact, they have really highlighted the word one. Still, many students will go for 2. Now, why they will go for 2? Because there's 2 marks here, and the major underlying problem with most students is they do not know how to elaborate on their answers. They always sacrifice depth for breadth. So what most students will think is, oh, it's for 2 marks, so let me give 1 point that would be a weakness for acupuncture, and let me give 1 point which would be a weakness for TNS. When you take this approach, you are directly violating what they have asked you here. They have asked you for one of the treatments. So if you're going to take this approach and you're going to name both of them, because despite them telling you to just take up one, they are obviously not going to credit the second weakness that you're going to present. If they wanted you to give for both, why would they have emphasized that, for one of the treatments give one weakness? Do not go against what is being asked in the question paper. It's not going to help you in any way. Rather, learn how to write answers, learn how to elaborate on strengths and weaknesses contextually, so that you do not face the problem of, I don't know what to write for 2 marks, so just let me write whatever is possible. That approach does not help. So what I'm going to do for now, I had mentioned acupuncture first, so I'm going to take a weakness related to that. One weakness we have learned of acupuncture is that since it involves needles, and needles are sharp and they can be invasive by nature, so many patients are going to be afraid of needles. So if Becky fears needles, then it might result in a lot of anxiety and stress, which might in fact worsen her pain. rather than reducing it with the help of the needles. So again, what I have to do is, in my mind, I can think of it this way, some reasoning, some logic. Then while putting it down on paper, I just have to follow a correct structure, naming the weakness, and then explaining it again with context to Betty, because we are still on the contextual question. So whatever I have thought of in my mind, I just have to put down in this structure, and that's how easy it is to get full 2 marks for this answer. Let's quickly write this answer as well. This is 11B. Okay, so first I'll name the weakness. One weakness is that the use of acupuncture could cause stress and anxiety to Becky, worsening her pain instead of relieving it. Now many students, again, one tendency is they would write only this point, or as I mentioned earlier, they write another point from the other treatment as well. Then they would say that I have written this point, and when I'll ask why haven't you elaborated or why haven't you explained, they'll go on insisting, but I have explained, I have elaborated, I have connected it to Becky's scenario because I've written her name over here. Again, it might seem very basic, but students need to understand the basics. That's where they falter. When it comes to explaining or elaborating something, you give reasoning. You explain why or what is the logic behind the point you're giving. Just naming somebody who's there in the context or just writing a little lengthy sentence does not make for an elaboration or an explanation. You have to do a better job than that. So what you have to do is, whatever weakness or strength you've given, you have to think of why. Why is this going to be a weakness? And that you need to elaborate or explain in the next sentence. So how I would elaborate on this is, since the treatment involves the use of needles, which are sharp and potentially invasive, Becky could perceive them as dangerous. So here I have explained why she would be stressed out or why she would be anxious. This is known as elaboration. This is known as explanation. Explanation always answers the question why. So I can get at the most 1 mark for the first sentence because that does not involve an explanation, but the second one does. So that is how I can get 2 marks. Okay, today I will not get into the 6 and 10 marker because I'm not having that much of time in this video. In the next part of this lesson, I will cover those answers. I get requested a lot for health psychology. Earlier, clinical and organizational used to be the dominant combination in schools. Today, because many students are interested in taking up biology in the future, clinical and health seem to be a very popular combination in the past 2 years. So I hope those who are looking out for support for health will benefit from this video. I'll try to bring up the next video soon, as and when my time permits. Thank you for watching this one.